My next guest is Alissa Hsu Lynch. She is the global lead of Google Cloud's MedTech strategy and solutions. We should also point out that she was recently recognized by Fierce Healthcare as one of the most influential minority healthcare executives in 2022. Now, some background: Google Cloud has collaborations with a number of Fortune 500 companies, as well as a number of smaller startup companies, and I spoke with her a short while ago about technology and prevention.
Alissa Hsu Lynch is joining us from Seattle. Thank you very much for being with us on behalf of thehill.com. And I really want to talk about technology and the impact it has on hospitals, on doctors, and on patient care. But I want to begin with how it impacts the data that these parties receive, and also on the issue of innovation that we're seeing, because it plays such a huge role in the care that we're receiving today.
Sure. So happy to be here. So I work at Google, and one of the things that we are really focused on across the company is helping billions of people be healthier. And we're doing that across a number of our platforms that are all really data-driven. So things like Google Search, YouTube, Verily, Google Ventures, Fitbit, and then Google Cloud, which is the part of the organization that I'm in. And within Google Cloud, we are partnering directly with healthcare and life science organizations to really help solve their challenges using our technologies, which include helping them with data, analytics, and artificial intelligence, AI, and machine learning. So, I know the topic we wanted to talk about today is innovation, in particular related to preventative healthcare. And one of the challenges that we're really trying to solve with preventative healthcare is getting people to adopt healthier behaviors. And this is really critical. So healthier behaviors like eating healthy, managing your weight, being physically active, getting enough sleep. This is really critical because 80% of health actually happens outside of the hospital. But the healthcare organizations that we are partnering with don't necessarily have visibility to what patients are doing outside of the hospital. So it's really hard for them to impact the patient behaviors to ensure that they're actually pursuing those healthy habits that can lead to more preventative healthcare. So one of the things that we recognize is that this data that patients have outside of the hospital is really, really valuable. And advancements in technologies like wearables, consumer wearables, sensors, even digital apps, really there's a lot of data that's being generated about patients that's outside of the hospital that would be super valuable for healthcare organizations to have. And so that's one of the big focus areas for us, is enabling healthcare organizations to get access to that patient data with user consent, and then providing them with the analytics, the insights, the AI to make sense of that data so that they can provide insights to care teams to take better care of patients.
So let me follow up on that point. What can the patient do with that data? What do doctors and nurses do with that? And can it essentially speed up a potential diagnosis for that patient?
Yeah, absolutely. So I think patients having that data in their own hands is really valuable for them to be able to take more accountability for their own health, to be able to track and measure what they're doing, and also just to get reminders. So Google acquired Fitbit in 2021, and Fitbit is a really great tool as a wearable to promote behavior change, to encourage people to pursue those healthy habits that they're doing well, but also to give them nudges to remind them, hey, maybe you should get up and go for a walk. So I think for patients, that data is really valuable. For doctors and nurses and healthcare organizations, that data can be really valuable if it gives them insights. Because what we've heard from healthcare organizations is we don't just want the data, we want the insights, and help us with the data. So that's something that at Google Cloud we focus a lot on, is we want to try to make it easier for them to interpret that data in a way that's meaningful and that it's actionable.
You are absolutely right about Fitbit, because I know in my own circle of friends and family, it's time for a walk. I need to go out. I'm wondering though, is there data that says this is really working, that this technology is encouraging, forcing, reminding people, take that walk, go for a swim, watch your weight, all the things that you're talking about in preventative care and health?
Yeah, so we just introduced a new solution that's called Device Connect for Fitbit. that brings the power of Fitbit. So think about Fitbit as being able to bring that data collection capability and combining that with Google Cloud and our data processing capabilities. So we're offering this to healthcare and life science organizations so that they can get access to the Fitbit data, do the analytics and insights, and then follow up with patients. So actually use that data to follow up with patients, to intervene when they need to, and then also to be able to measure those outcomes. So I think that's critically important what you brought up in terms of how do you actually know whether it's working. So I think it's tools like these that will enable healthcare organizations to actually not just reach out to patients, but be able to track and measure their progress.
And I'm wondering if you can assess COVID-19, 2.5 years into this pandemic. It has impacted every American in either a big or small way, directly or indirectly. In your world with Google, how has COVID changed your approach, your research, and the technology?
Yeah, so COVID has changed so many things for all of us, but I think what we've seen from the organizations we're working with is a much bigger focus on data and leveraging real-time data to give them insights. For example, we're working with an organization called Q Health that makes at-home readers, and they came to Google Cloud to really ask, can you help us predict where the next hotspot's going to be? Where is the next outbreak going to be? Because we have this great data, testing data, diagnostic data, but we want to be able to help the government understand where might that next outbreak be. So we've been partnering with organizations like them, directly with the government, with other institutions, really to unlock the power of data to be able to be more predictive and to provide more insights during COVID-19, just about the pandemic in general.
And as you well know, when it comes to research and technology, often there are different silos. I'm wondering, with your partners, are you able to share that information, share that data for the common good?
So we do make available a number of public data sets, including social determinants of health data sets. But really, our Google Cloud approach is we don't own the data. Our customers own the data. So we certainly facilitate conversations. We love to be part of collaborations where we're enabling stakeholders across the healthcare ecosystem to be able to share information, share learnings, and share their data with each other. But just to clarify, Google Cloud, we ourselves do not own that data, and we're very careful about that because it is often patient data that we're not allowed to touch.
And again, keeping in mind any confidentiality issues, but as you go through this data and study it, for somebody who's been so immersed, what has surprised you? What has stood out in your own world?
Yeah, so one of the areas that I've really been spending a lot of time on is AI, so artificial intelligence for medical imaging. So this is a really critical area, particularly as it relates to preventative care, because medical images, so think X-rays, CT, MRI scans, these are used to screen and diagnose patients every day for diseases, for COVID-19, X-rays of the lungs. And medical images are really critical, and they're really large. They sit in silos across organizations, and they're not very useful for AI unless we can enable interoperability, drive some standards around it. And so that's one of the focus areas we've been looking at, is enabling medical imaging AI, because it is data that's growing. It comprises about 90% of all healthcare data. And it's growing, and that's increasing the burden for healthcare workers. So we've heard a lot during the pandemic about the burden that healthcare workers are under, and it's the radiologists, it's the researchers that are tasked with interpreting these medical images in order to provide patient care. And we know that AI can actually enable faster, more accurate diagnosis of these medical images, but companies need help with developing the AI. So we are, introducing technologies. For example, we just introduced our medical imaging suite that is designed to help healthcare organizations accelerate development of AI so they can get to that faster, more accurate diagnosis, help increase productivity for healthcare workers. And just one example, we're working with Hackensack Meridian Health. They are a network of providers in New Jersey, and they're using these tools and technologies for earlier detection of metastasis in patients with prostate cancer. And this is a life-threatening outcome that disproportionately affects Black men in the US. So by leveraging AI, they are looking to be able to detect this much earlier, so then they can help intervene and prevent diseases like that. So I think it's a good example of just how powerful AI can be, but the healthcare ecosystem really needs help with these newer emerging technologies, and that's something that we focus a lot on.
I want to come back to that point, and thank you very much for being with us as you join us from Seattle and talk about the work that you're doing with Google Cloud. But how do you deal with the health disparities?
Yeah, so I think, technology has really enabled a lot of good. Technology now enables us to have information at our fingertips anytime, anywhere we are. And, in thinking about that, Google really believes that information is also a determinant of health. So there's been a lot of talk about the social determinants of health and disparities in care. And we believe that information is a determinant of health and can actually help lead to better, more equitable care. So how are we addressing this? So some ways are we recognize that there are 1 billion health-related searches on Google search every single day. That fact baffled me. It astounded me. 1 billion health-related searches every day. So we want to make sure that there's credible healthcare information out there when people are searching. And we're partnering with organizations like Kaiser Family Foundation and other authoritative health sources to boost the quality of information that's on Google search, that's on YouTube. YouTube's also used very much to answer health-related questions. I know I do that myself. And also we're introducing new features that make it easier for people to use the technologies they're familiar with. So within Google search, we've embedded appointment availability. We enable people to find in-network care right in their search result. And also we are trying to make it easier to navigate US government programs like Medicaid, which, disproportionately, certain populations are relying on.
And finally, as you rightly point out, so much on our phones. I mean, we live on our phones, so much information. When it comes to your world of healthcare and technology, we have seen an explosion of change really in the last 20 to 25 years. We've lived through all of this. And I'm curious just to get your thoughts about what we will see in the next 10 years, especially with Google Cloud and the partners that you're working with.
Yeah, I think one thing that we learned from the pandemic is collaboration is key. So we saw pharmaceutical organizations, research institutions, governments, countries really coming together to develop these vaccines to save people's lives. And I think that really showed us that we can accelerate innovation, particularly in the technology space, if we all partner together. So that's one of the things that I hope we continue moving forward, is just greater collaboration across the healthcare ecosystem and even outside with technology companies and government, et cetera. I also think, though, and one of the things we're trying to drive is more adoption of these emerging technologies, because we know that things like AI can lead to more earlier detection and prevention of diseases. It can help expand access to care where maybe there are shortages of doctors. But there are barriers to that adoption of these emerging technologies. So that's something that we're thinking about a lot about, which is how do we ensure there's data interoperability so the data is useful for organizations? How do we make sure that people can get trained up and they can partner with technology companies to upskill their internal organization's capabilities? So those are a lot of the things that I think are going to be needed in order for us to really realize the potential of these great technologies.
And bottom line, saving lives and allowing Americans to live longer.
100%.
Alissa Hsu Lynch is joining us from Seattle, Washington. Thank you for the work that you do, because your success clearly is our success. We appreciate your insights and your information. Good luck.
Thank you.